welcome to another episode of Coffee Talk with Encore. Today, the focus of our coffee talk is on the topic of knowing the why behind our clinical interventions. So what does knowing the why mean to clinicians? Well, it means understanding the unique value that each of us brings to our profession, which then leads to purposeful evaluations and interventions. Knowing the why also demonstrates how clinicians have used their critical thinking skills to analyze each of their patients' deficit areas and then utilize that knowledge in choosing the most appropriate solutions to patient challenges or deficit areas. So in essence, in order for us to understand the why, we have to be proficient in determining the underlying cause of the functional deficit.
So it's not enough when we do our evaluations to just write down what level of assistance a patient needs. We have to really dig deeper. We have to look beyond that assistance level and figure out what's actually preventing the patient from being independent with a task. And sometimes it's truly strength, but a lot of times it's their coordination, their ability to motor process. It might be their ability to control the movements in the right order. So we see a patient that has that strength that's really pretty good when we test just their strength, but then we start moving and it all falls apart. And so we need to look at what's causing them to not be able to put those pieces together. Is it their strength? Is it their range of motion? Are they kicking in some spasticity or some tone? Or is it really that they just don't know how to put those pieces together anymore and we need to work on their sequencing or their safety awareness? And then we can kind of figure out who should be treating and how they should be treating.
Exactly, Becky. I think that once we have that root cause figured out, we really need to center our plan of care and our goals around that root cause. So really focusing on the smaller goals to get us to the larger long-term goals. So really picking specific interventions that do center around our root cause. So for example, exercises, they really need to be focused. We're not going to obviously give all of our patients the same blanket exercises, whether we're treating lower, upper extremities, or even swallowing. So really picking your exercises intentionally, if that's part of your plan of care, and then really kind of focusing your short-term goals towards your long-term goals in that hierarchy. So what do you want your patient to be able to do in the first 1 or 2 weeks of your plan of care to get them to that long-term point of what you want them to be able to accomplish by the end of your plan of care? So really kind of knowing our root cause will not only help us focus our plan of care, but also help us focus our treatments and help us to practice at the top of our license.
That's so right, Ashley. And unfortunately, at times our documentation, it just doesn't paint that picture to really show the progress that we're making toward achieving goals. And, when those goals have been written in too broad of a manner, there's far less progress that can be seen. But when we're writing those short-term goals with smaller increments of change, and then we're meeting those short-term goals, it's great because we're really giving our patients credit for all the progress that they're making in therapy. And additionally, really including that descriptive, phrasing and those words into our documentation, it not only helps make that, progress toward reaching those goals clearer, but it really also shows evidence of clinicians really understanding the why behind the interventions and the strategies that they're using.
And kind of piggybacking on what Ashley was saying and what Kathy was saying, once we have that root cause figured out, those intentional interventions are key to our clients making progress, right? So making sure that we're really focusing in on providing interventions that are the most appropriate for this patient, for this root cause, for this functional deficit. The cookie cutter kind of interventions, they don't work well for our clients. They don't make progress that way. And we know with managed care insurance companies, our documentation is being looked at, right? Our plan of care can kind of be dictated by someone other than us. And so it's important that when we pull up that documentation, that the insurance companies, the reviewers, whoever it is, can see that we've been providing treatment that is intentional, that is very focused. And that it's best for our clients too, right? Because we're able to get them home sooner, we're able to get them better, faster, and it's just good all around.
Fantastic. And oh my gosh, what a great discussion today on the topic of knowing the why behind clinical rationale, the interventions, and in documenting our skill. Certainly, we want to make sure that we're including all of our functional and intentional treatment approaches in our documentation. And as we've discussed today, breaking down our patients' functional impairments and knowing the why behind our interventions, it will make a huge difference in producing the largest functional impact on our patients and their ability to be as independent as possible. Well, thank you everyone for joining us today to learn all about knowing the why behind our clinical interventions. And we look forward to having you tune in again for our next episode of Coffee Talk with Encore.